We know some kids who have suspect signs of autism might get a little bit better. How do you know that you give a therapy, it worked?
Well, in our case, we have data. In a behavioral approach, you see the progress both in the child but also on your data.
So you are very careful to document what the kid was like, what you did in a very honest way. You either gained or lost. We assume most of the time it's a gain. You also probably put some indicators that parents are doing what we tell them to do at home.
Right.
Okay, you're not there to see it because it's not a 2-hour day thing. Is that correct?
Right.
Okay.
Right.
But I guarantee you know who's going to do it. I know you. You're pretty good at this. Okay. So, but ABA, when I hear it, originally, I thought some cruel, mean person with it wasn't. I saw a different approach. But I have a question for you. There's other therapies. I don't even know what it is. Floor time. You know what floor time is?
Sure.
What's the difference between floor time and ABA?
Well, floor time is actually a component of what they call DIR.
Using these terms, I'm only a PhD.
It's a very different approach. That approach would approach children from autism from a developmental perspective purely, and it's about establishing relationships. And I'm so not a floor time DIR expert, so I don't really want to.
But it can work in some kids.
Well, it's hard to know because it's never been really studied in a controlled manner.
But some people say in certain situations, maybe the kid doesn't get better, it helped. The same thing in ABA. We assume, done correctly, it works.
Well, I would just basically argue that if you do something systematically, and you do it intensively, and you do it responsibly, and you use the child as the expert. So if you're not seeing progress, then something isn't going right, and you either need to change what you're doing or get some help. And so, I know some people who are DIR or floor time people who I think probably do excellent work. And
so it's as good as a therapist sometimes.
Well, it's not just as good as a therapist because there are some therapies out there that have actually been shown to be harmful.
Like what?
Like facilitated communication, for example, or some of the metal toxin detoxification.
Well, I actually did a video today, believe it or not, with a hematologist that does chelation. When they get transfusions, they build up iron. We went through how difficult and how dangerous it is. You can die done improperly. And we can't find a study where it was double-blinded, evidence-based that says it works.
Right.
And I said to him, maybe under very controlled situation, it should be done to put it to rest.
Right.
Okay, and then I found out from email, something, I get chelation. He gave some fakakta herbs from natural, that ain't chelation, and a guy gave an IV, and I have news for you. What do you know was put in the IV? And you can't bill for chelation and autism, so if he's billing for heavy metal poison, possibly lead, he's lying. And if he's lying, how do you trust anything else the person does?
Yeah.
And I heard some of these guys are getting $8,000 to $20,000 a year for it. One case, $80,000 from a rich family.
It's crazy. Look, it's the you can sort of understand what a family of a
I don't begrudge anybody.
Right.
I just don't want you to put your kid in harm's way.
Well, and that's sort of how I think that if you're going to try something, whether it's a medication, whether it's a treatment, whether that the people providing that treatment should be very clear about what their procedures are, what they expect to change, how they expect to demonstrate this change, and and then how are they going to measure this change? Because if that's the case, if a physician said, if I give you a gluten-free, casein-free diet, and that will change your child's behavior. Well, measure his behavior before you put him on the diet. Tell me exactly what behaviors you...
Independent.
Tell me what behaviors you say are going to change. Let's measure those behaviors.
Has it been
put
done?
him on the diet.
Has there ever been a study like that? Okay, you can find one? I couldn't find one.
No, that's the concern I have. That's why, you've got... And I'm concerned about it simply because I think probably my guests will tell me that down the road, if somebody ever took the time to do these studies, some of these ancillary treatments would be shown to be quite beneficial. And I, as a speech-language pathologist, as a program director, would feel far more comfortable and actually legally allowed to recommend them. See, as an educator...
So in other words, there could be, it might be for selective, some of the therapies that are not considered standard could possibly, but they get to be studied correctly.
Well, I agree. I mean, you can't possibly think... We know for a fact that applied behavior analysis is not the end-all, because there are some kids that are just not achieving best outcomes. In other words, why is it that, not all of my kids at the same, and I've got children, for example, who are cognitively matched, so I can't just say, well, they're less capable, that's why they're not achieving. No, they're cognitively matched, yet some kids appear to do better than others. So my argument is we haven't yet figured out all of the effective treatments. The problem for me is there are 50,000 of them, and as an educator, I can't spend my time spinning my wheels trying them all. And I would hope and expect...
Well, you should only do what you know well. You don't...
Well, I'm going to do what works. And right now...
You should never try something you don't understand. You should do what you understand.
Right.
Like I said, if you're going to pick a job to go into something you like, you understand, you invest in the stock, make sure you know what the company's about, you do your homework.
But as evidence starts to get published, we begin to integrate those kinds of procedures into our program.
So there could be some kid on a gluten-free diet maybe benefits from. We don't know.
Well, look, the truth of the matter is that
it's not going to hurt the kid.
There are typically developing people who have medical conditions that makes a gluten-free, casein-free diet beneficial. So why would we not expect that there would be people with autism who would have those same needs? The problem is...
I don't think it's going to cure the kid, but it's going to make his life better.
Of course. If you're uncomfortable, you're not going to learn as well. If I'm not feeling well, I'm not learning as well. If I'm chronically uncomfortable, I'm not going to learn as well.
I went to an eating disorder specialist for children, and the first thing she says, keep the pipes clean. If they reflux, you control it. If they're constipated, make it flow. And, she gets great results. She gets babies who can't be fed.
Sure.
I went to a guy, he's a physiotherapist. He's from Chile. He gets kids who they say can never sit up. He does physiotherapy. He does a different technique. Gets the brain to sort of like anticipate it, off balance something. And some of these kids who said they could never sit up, he's getting some of them to sit up. He's not doing miracles. Right. Some they couldn't. He's getting a few. I was very impressed. And he said, I give them 4 therapies, only 4 attempts. If I don't see any progress after the 4th, I stop. I can't cure them all. I can't help them all.
Right.
And he doesn't charge a lot. And he comes up to New York, and I was very impressed because he said, I can't do it all.
Right.
If anybody could say, walk in the front door, give me a 10, 20, I'm going to cure a kid of autism because I cure them all, walk out of that door. Is that correct?
Right. Well, absolutely. First of all, while I do believe that there are children with autism who can go on to lead perfectly normal lives and be completely absent of a diagnosis, I think we make a big mistake if we put that out there as our only cause. I have 2 young men, for example, who are twin boys with autism, who are teenagers now. They're 18. They're still basically not very verbal. They're still quite dependent upon constant supervision. But I think that they're doing terrific. They recently took up running and are now running 6-minute miles and are now on their high school track team in their local high school. They still attend my day school because they still have significant autism. But if we said, oh, are they cured, the answer would be not even close. And then does that mean we didn't do our jobs?
No.
I think both of their parents do they wish that their kids were normal? 100%. But are they very happy with how far they've come? Absolutely. And so, best outcome is a moving target. And if we put only cure as the best outcome, we're really doing a disservice to kids who are...
Better life, better quality of life, improvement in the relationship with the family.
High achieving your potential, pushing so that you can become independent. Identifying what are the quality of life indicators. What makes you happy? Do we want every kid when we get them to be cured? 100%. If we could do that, and give them a chance at
So
a
in other
very
words,
typical
you're trying to
life.
put yourself out of business.
Well, that would be great. But I don't believe that cure or recovery is first of all, I don't believe that that's going to happen for most people that we work with, and I think that we have much more responsibility to ensure that we're really maximizing the kid's potential.